Happy Thursday, everyone. Thank you for spending your lunch hour with us to learn a little bit more about balanced nutrition after cancer treatment. As you just heard, my name's Nicole, and I'm going to be presenting today with Mia, my colleague and friend. We actually both did our dietetic internship here at Cleveland Clinic, and we both have several years of oncology experience under our belts. So feel free to ask any questions through the chat, like Krista said, during this presentation, and we're more than happy to answer what we can. Krista, next slide, please. So again, you guys have met us. The purpose of this Survive and Thrive support series is really for us to discuss various topics, support each other. Like I said, today we're going to be talking about balanced nutrition. But one thing we do request is that you do not give direct medical or nutrition advice to each other. The information we present today also is not going to replace the specific medical or nutrition advice that you might have already received from your doctor or dietitian. The concept of survivorship nutrition can help you in creating optimal eating patterns as you navigate life after cancer treatment. And research suggests that that same evidence-based guidance that helps prevent cancer can also prevent or help to guard against its return. So with that, we'll move forward to our objectives. And like I said, feel free to toss in some questions in the chat as we move along. Today, we're going to be defining the basics of a generally healthy diet after cancer treatment. We will review the American Cancer Society recommendations for physical activity, and then we'll also review some common media trends that address frequently asked questions about diet fads related to life after cancer. But I do want to note that nutrition goals should be personalized to you. Due to the nature of this presentation, the information provided is only the basics. But should you have additional questions related to your personal nutrition goals, we'll provide you with some information about how to get in touch with a registered dietitian at the end of the presentation. Next slide, please. Okay, so first, we want to talk about, what to eat more of. Because trust me when I tell you that a dedicated dietitian is going to encourage you to think about all of the amazing and delicious foods that you can eat to provide you with health benefits, rather than only focus on foods that you cannot eat. The basics of general healthy diets and balanced eating focuses on whole, unprocessed foods. It's recommended to consume foods in their natural state. So for example, you will get more health benefits from consuming a whole apple rather than applesauce. When foods are over-processed, they tend to lose that nutritional value. Fruits and vegetables are an excellent source of antioxidants, phytonutrients, and fiber. Antioxidants and phytonutrients are both considered to be cancer-fighting, meaning that they reduce the free radicals in our bodies to prevent the recurrence of cancer cells. When you go grocery shopping for the week, of course, pick out your favorite fruits and vegetables, but don't forget to try something new every now and again too. When we think about whole or unrefined grain products, think of things like brown rice, whole grain, oats, quinoa. Those are all great sources of B vitamins, a variety of minerals, and then fiber, and those plant-based proteins that we're looking for. Think of a refined grain product that you might have in your pantry at home, and how can you swap that for a whole grain product? So maybe it's white bread that you could swap for 100% whole grain bread. Maybe it's pasta noodles and you could try something like a chickpea pasta noodle. Those little swaps really go a long way when it comes to reducing the amount of processed foods that you're consuming. The other piece to consider would be lean protein. There are great animal products that have lean protein, things like chicken, turkey, fish. Those are all great options when it comes to reducing the fat content in the animal proteins we're consuming. But we can't forget about those plant-based proteins either. So things like beans, legumes, nuts, and seeds, those all have really great health benefits that research has shown, choosing more of a plant-based or a meatless meal a couple times a week can also help to reduce, or lower the risk of cancer recurrence. And then I do want to mention, we don't want to forget about heart healthy fats because that has great benefits when consumed in moderation. We get heart healthy fats from things like fish and nuts and seeds, olive oil, anything that's liquid at room temperature compared to something like a stick of butter that stays solid at room temperature. So incorporating more of those heart healthy fats can also lead to success in the future when we're looking at a balanced diet. If we could go to the next slide, please. When we're thinking about our goal to incorporate more unprocessed foods in our diet or those whole foods, then on the flip side of that is that we need to be mindful of the recommendation to eat less processed foods, especially those highly processed foods. And you can run into these highly processed foods from any food group. It includes things like meats, deli meats, sausage, pepperoni. All of those are very overly processed compared to something like chicken or turkey. Packaged and convenience products like frozen meals can also contain a lot of additives. And then, like we talked about, the refined grain products like white breads, crackers, and especially those sugar sweetened desserts, we want to reduce the consumption of those specific items. The American Cancer Society recommends limiting red meat and processed meat consumption to no more than 12 to 18 ounces per week. So that's about 3 to 4 standard servings of meat, so about the size of your palm. This is because there is a lot of strong evidence and research that consuming too much red meat and too much processed meat can actually increase the risk of cancer recurrence. So by reducing the amount that you're eating of that, it will help to lower your risk of cancer recurrence. And then one piece I don't want to miss is beverages. When it comes to beverages, it's recommended to limit or avoid consuming sugar-sweetened beverages like soda and juice, as well as alcohol. Alcohol is a known carcinogen, which means that we know there's a direct link between consuming alcohol and cancer recurrence. So should you consume or choose to consume alcohol, the American Cancer Society recommends no more than 1 standard serving for females and no more than 2 standard servings for males per day. So overall, diets high in processed foods and low in those unprocessed foods can contribute to weight gain, overweight, or obesity. And again, research shows us that a higher body weight is a contributing factor to 12 different types of cancer and cancer recurrence. So reducing the amount of the processed foods we're consuming, again, helps to lower that risk. We can move to the next slide. Thank you, Krista. Prepackaged fruits and vegetables are also considered to be processed foods, but don't be afraid of like your frozen bag of veggies because we still get a lot of benefits from those frozen veggies. But it's important to continue to wash produce items like your fresh broccoli that might come in a bag compared to the frozen broccoli in a bag, because there is some potential for residue of pesticides, fertilizers and bacteria to be left over on those pre-washed bags of veggies. When you are preparing something like frozen or canned fruits or vegetables, be diligent and read the nutrition facts panel on the back of the can. Look for low sodium options without extra additives or preservatives. You really want the ingredient label to just say frozen broccoli. That would be ideal. Next slide, please. Okay, so we're going to kind of transition a little bit here because we know that our dietary choices and the things that we're eating affect our long-term health, but so do our physical activity choices. So the American Cancer Society recommends about 150 to 300 minutes of moderate intensity activity, or the option of 150 minutes of vigorous intensity activity each week. And at this point, you might be asking yourself like, okay, Nichole, what does that mean? But we'll review specifics on the next slide. Benefits of staying active include improved energy levels, improved mental health and outlook. It can lessen depression and anxiety. It can improve your sleeping habits. We're looking to maybe rebuild some lost muscle strength after chemo and radiation. And exercise can really give you those benefits. It can help with bone health. And it might even help you to achieve a more optimal weight. If you're currently in a sedentary position, maybe not doing much physical activity at this time, that's okay. Start slowly and build up your physical activity over time, because the more active you are, the greater the benefit. And don't be afraid to try something new, like a Zumba class or chair yoga. All of those count as physical activity that you take part in. If we flip to the next slide, we'll be able to get some examples of kind of what we're talking about. So again, the American Cancer Society recommends 150 to 300 minutes of that moderate intensity activity, or 150 minutes of vigorous intensity activity. So that translates to about 2.5 hours to 5 hours of moderate activity, or 2.5 hours of vigorous activity. And that's every week. So when we break it down from minutes to hours, it doesn't seem that daunting. We could get in a couple walks every week to reach that goal. If we review the table on the screen here, try to find an activity that you would enjoy. Physical activity should not be something that we think of as a chore, or, like you don't want to feel like, oh man, I've got to go to the gym. It should be something you're excited to do. So think of activities that you might be able to enjoy with your family or your friends. If we flip to the next slide, we are going to transition again just a bit here. We want to, kind of reiterate, you might have heard it before, that at Cleveland Clinic, we practice evidence-based care. So what this means is that we will only be providing you with sound recommendations backed by research. The remainder of this presentation is going to focus on common nutrition fads and those frequently asked questions related to nutrition after cancer treatment. Next slide, please. We're going to start off with nutrition supplements. If you guys have by chance ever met with myself or Mia or one of our other really amazing dietitians at main campus or at a region, you might have heard us ask a couple questions or remember us asking about this, because that's something that's important when it comes to long-term health. Nutrition supplements include vitamins, minerals, herbal supplements, and traditional medicine, as well as protein supplements. When you are thinking about nutrition after cancer treatment, you might be thinking that you need a nutrition supplement. But before you go and purchase anything, it's important to first ask yourself, can I get what I'm searching for through food first, from that whole foods approach that we talked about at the beginning? Because we can obtain all the vitamins and minerals and nutrients that our bodies need from food alone. So we do encourage at Cleveland Clinic that you avoid supplementing your diet with anything that's not prescribed to you by your physician, due to the potential concerns that supplements can bring. Supplements are not regulated by the Food and Drug Administration, and therefore they're not always tested for quality, purity, or safety. These supplements can be very expensive, and they can potentially interact with other medications. So before you take something over the counter, feel free just to run it by your doctor. It could even be your primary care physician. That way we can review it and make sure it's a safe choice for you moving forward. All right, so with that, I'm gonna pass this off to my colleague, Mia.
Sure, thanks, Nichole. So another question we get a lot is about sugar. So we'll just talk a little bit about sugar and added sugars. So when we eat carbohydrates, they are broken down into sugar for our cells to use. So our cells, healthy cells, cancer cells, they do use sugar for energy, but that's its main source of fuel. So carbohydrate foods are going to be things like bread, rice, pastas, fruit, all of those things, desserts, those are all going to be sugar foods. Even dairy has sugar in it. And as I mentioned, sugar is glucose. So glucose is, again, your body's main fuel for energy. But if we were to cut out glucose or sugar from our diet, our body can still turn protein and fat into sugar. So therefore, we don't recommend cutting out any certain food groups unnecessarily, because you could be cutting out all of these wonderful foods, as Nichole mentioned earlier, whole grains, fruits, low-fat dairy. These are all things that have carbohydrates in them that if you did cut out sugar, you would have to cut those types of foods out, and that's just not necessary. So really just emphasizing balance, moderation. You can have some sweets here and there, but, in a balanced and moderate way, along with a rest of a healthy diet. Next slide, please. So here I just wanted to talk a little bit about added sugar, because there is a difference between like natural sugar and added sugar. So the US dietary guidelines recommend limiting calories from added sugars and saturated fat to less than 10% of your total calories for the day. So this slide is not meant to make you feel like you need to count calories or count, sugar, and all of that, but just be conscious of it. So on the picture here is an example of a nutrition facts label. So added sugar is underneath the total sugar line. So if we talk about something like Greek yogurt, that might have, natural sugar in it that would be present there. And then it might have some like added sugar along with it. So you just want to be conscious of the difference between total sugar and added sugar. And so for females, we could recommend like 25 grams of added sugar per day to limit to. Males would be 36 grams of added sugar. So if you are someone who is a label reader, you like being conscious of that sort of thing, you can translate it to those numbers there. And I do want to say another thing about sugar is that it has many different names. So things like brown rice syrup, white sugar, brown sugar, honey, agave, these are all forms of sugar. So it's still a sugar. There is no evidence-based research to suggest or support that sugar directly increases cancer recurrence. So kind of some of the things Nichole mentioned earlier, it's a combination of things, your diet, your physical activity. There is not one food or food component that is going to directly increase your risk of recurrence. And then just a comment too, I know Nichole touched on this earlier, sugar sweetened beverages can lead to weight gain, which is what's going to be more associated with cancer recurrence. Artificial sweeteners are safe to have. That is another question I do get asked a lot. Things like aspartame and other artificial sweeteners, those things are fine for you to have. It can actually be a good tool to help you reduce your added sugar consumption. And it can help be a good, easy swap for you to choose like diet beverages instead of sweetened beverages to help with weight loss if you are seeking to lose weight. Next slide, please. So the keto diet is another question we get asked a lot. So for those of you who don't know, the ketogenic diet is where you would cut out all forms of carbohydrates and you would just be eating protein and fat foods. It can help with quick weight loss, but we want to think about sustainability too. Is this sustainable for you to be on a strict diet without any carbohydrates or with a very small amount of carbohydrates? And is it enjoyable? Nichole mentioned too, like we want to enjoy our foods. It's very important to have a good relationship with food. We don't want to restrict yourself. And as I mentioned before, regardless of what we eat, our body still uses glucose for energy. There is no evidence-based research to suggest or support that a ketogenic diet is appropriate or recommended. Soy is another question we get a lot. I know for me specifically, I work with breast cancer patients, so I do get this a lot for breast cancer. So soy is like a plant-based protein. It has fiber in it. It has these components called isoflavones, if I'm pronouncing that correctly, and that's an antioxidant. So soy is safe, actually. You can have up to 1 to 2 servings per day of whole soy foods. So that's going to be like tofu, tempeh, miso, edamame. Those are some examples of soy foods. The one thing you do want to avoid is the soy protein isolate, which is going to be like a soy supplement powder sort of thing. So if you are going to choose to have soy, we want you to go more towards the whole soy foods versus like supplements. Next slide, please. So the key takeaways of this presentation are just going to be keeping active. Again, as Nichole mentioned, really finding something that you enjoy. You do not want to think of exercise as a chore. It can take time to maybe like try different things and find out what you like and what works for you. But it can help so much, not even just with like from a weight loss perspective, but like Nichole mentioned, like mental health, good sleep, all of that. So very important to find activity. I think we all can agree that Americans are very sedentary. So really trying to find an exercise you enjoy. Obtaining and maintaining a healthy weight. So this is something, if you are trying to become a healthier weight, we aren't just focused on like BMI. There are a lot of things that can affect your weight. So don't feel like, you know, if your BMI is considered like overweight, but you do have a healthy diet, you are physically active, you are limiting alcohol, you're doing all of these things, but your BMI isn't perfectly a healthy weight, that's okay. You know, we want to just kind of look at like the overall picture. And that's something too, if you are seeking help one-on-one with a dietitian, I'll have information on the next slide on how to schedule with us. But we do a lot of one-on-one appointments for you guys. Eating a balanced, colorful plate. So, yep, with all of those wonderful foods Nichole was talking about earlier, just trying to incorporate more fruits and vegetables into our diet at all of our meals and snacks. Prioritizing hydration, so not those sugar sweetened beverages, but like water. You could do, you know, any diet beverages, things like that. And then minimizing or avoiding alcohol consumption. So again, for females, 1 drink per day. For males, 2 per day is considered safe to do. That does not include like stacking up all of your drinks and having like a bunch of drinks on a Saturday night. It's going to be, you know, again, 1 a day for females, 2 a day for males. So if you are interested in working with one of us, the scheduling number is listed here. Just call us and the operator will get you set up to speak with a scheduler. We do offer phone and virtual appointments certain days of the week, or we can be in person. So depending on your diagnosis, there are, you know, I only work with certain disease groups, same with Nichole, and then the other dietitian does as well. So just kind of depends on which cancer you have that you, depending on who you work with, but we are all open to working with whoever. So yeah, thank you all for joining us. And if you have any questions, you can either raise your hand or type it in the chat box.
Thank you both, Nichole and Mia. Before we take any questions, I am going to stop recording. So just so everyone is aware of that.